Welcome back to our second segment of Chamber Exchange, a TV show brought to you by St. Vincent Hospital and Bank Hometown. Pleased to have with us in this segment an old friend, David Morales, from our time together up at the State House a few years back. But we're both in different roles now, and you are the general manager for Wellpoint. And for our viewers, maybe you could talk about Wellpoint and the role that you play across the state with state employees and retirees.
Absolutely.
Yeah.
Well, first of all, thanks for having me on, Tim. It's an honor to be here with you and to always see you. Wellpoint is the largest health plan for state and municipal employees. We have over 200,000 members in the Group Insurance Commission. The Group Insurance Commission is a state entity that essentially procures or contracts with health plans like Wellpoint to administer health insurance on behalf of their state employees. The wonderful part for us is that we continue to have an incredible success in the marketplace, supporting the Group Insurance Commission for both active employees and, to your point, retirees. We're also the largest plan for retirees for the GIC.
And then the idea is, the Group Insurance Commission, if a large group can go out and purchase, their purchasing power is theoretically better and hopefully command better rates that help both the state and the employees. And then municipalities have the ability to opt in and secure their insurance through the state to kind of hopefully move some of that administrative burden, but realize some savings.
Exactly. It's interesting, the last couple of years, there have been quite a good number of municipalities that have entered the Group Insurance Commission. This July 1st, we just had 11 enter. So we are proud at Wellpoint to be receiving and supporting all these municipalities through the GIC. Again, as I said, we're the largest, so it carries a lot of responsibility for us to administer and support these members.
Right. And part of it's just getting that information out. On a regular basis, as we listen to our members, in the top 4 or 5 issues is obviously health care costs, and they want to do the right thing by their employees, but what's that balance in terms of employee contribution and employer contribution, and how do you just every year you're going through that procurement, and oftentimes there are choices not only for the company but for the employees, and it can be kind of overwhelming and daunting. And so you're out there trying to let municipal employees, state employees, and retirees know that this is an option.
Absolutely. I spend about a third of my time on the road. Our offices are in eastern Massachusetts. We're in Worcester today. So I'm on the road a lot, especially to educate and engage. To your point, healthcare can be confusing for a lot of people. So we try to educate as much as we can, not only on the road, but as importantly through social media, through digital tools, through information packets. It is easy to get lost in the healthcare system. So part of what we try to do with our members is educate. The main theme of our organization is your whole health is our whole point. And part of that is education.
Yeah. And I know, you over the years, but certainly any group or organization you want to be associated with, is that education, but it's also that support, being able to answer questions, and that's a big piece of what you're able to do as well.
Absolutely. One of the things that distinguishes Wellpoint from our competitors considerably is we have live people helping you. You call Wellpoint's customer service or clinical care support, we have people.
Live people. That's a big deal today.
We have live people. They live in Massachusetts. Yeah. They know the market. And so, look, it's important to have digital tools and artificial intelligence, really important. But it's just as important, if not more important, to have somebody who understands you, knows the market, and that can guide you through the confusing maze of healthcare.
Right. And part of, I know the mission too, is, yes, being there when there's a health issue, being there when there are administrative questions and those types of things, but also focusing on working with members on things, preventative care, things that they can do to reduce the likelihood of having to utilize services.
Absolutely. So we have this concept called whole health. Typically healthcare for decades, in my view, has been considered as sick care. We have a hospital, physician office. When we get sick, we go. Well, we've been trying to flip that paradigm and call it whole health. Health essentially starts with us. Over 80% of what affects our health happens outside of the healthcare system. What we eat, how we exercise, how we treat our bodies, our mental health. And so our model really is focused on proactive engagement. So we encourage our members, for example, to get their annual wellness visits, stay engaged with their primary care doctor, stay engaged through our digital tools. We send out a lot of information in a very simple format, whether it's text messages, emails, calls, to get our members proactively thinking about their activity, their healthy habits, their diet. We have a whole suite of support. If you call Wellpoint and ask for a dietitian, you'll get a dietitian. You call Wellpoint and ask for a mental health counselor, you'll get one. Part of what we're trying to do, again, is address whole health, and that happens outside of the healthcare system.
Right, right. And in that regard, do you see, everyone's talking about affordability these days, healthcare costs, but as people engage in a more preventative, proactive way, are you able to turn that curve a little bit or make progress in that space? Great
question. Look, healthcare, unfortunately, Massachusetts is now one of the most expensive states in the nation for healthcare. The two parts of this. There's the policy part, which has been well documented publicly. Over 2/3 of what drives healthcare costs in Massachusetts are provider prices, pharmacy prices, et cetera.
Part of providers being the hospitals,
physician prices, pharmacy costs, et cetera. We're a high-cost state, and so those services are expensive. Part of what we try to do is partner with those providers to say, what are the best places for our members? Best quality, most cost efficient. So for example, we steer, encourage, influence our members as much as we can to visit primary care. Why? We want you to stay ahead of the curve, want you to stay healthy, stay out of the hospital.
Right.
Number two, we educate about ER use versus urgent care. The most cost-efficient place to do an urgent care visit is an urgent care center, not an emergency room.
Right.
And so we're trying those tactics to educate because A, that helps to drive down utilization of high-cost providers, and B, the more healthy we stay together collectively, the lower the cost of the premium. And so proud to say that Wellpoint is the lowest premium product overall in the GIC, and we've done that partly by partnering with providers, but also by educating members to stay at the most cost-efficient places.
Right, right. And that like anything else, that message just has to be consistently driven over time to understand, to get people to pause and think, do I really need an emergency department, emergency room? Maybe this is an urgent care. And that just reduces backlogs and costs, things that drive costs. In terms of advice that you would give members, like, is it get on the app, use the tools? Is it, if a new member, how do they engage with you in terms of just if they were just joining? Great question.
So what I have found during my tenure at Wellpoint is that most consumers don't really understand health insurance or their benefits. And believe me, the plethora of benefits available at Wellpoint are incredible. And so part of it is reminders. We send out a lot of reminders to say, look, check your digital tool. It's called Sydney, the Sydney Health app. It's the most advanced health app available. And so you can communicate with your doctors. You can do a virtual visit. You can check your claims. You can do a chat with our customer service or our clinical nurses. Stay engaged, right? Number one. Number two, try to be considerate about where do you go for health services when you need them. To your point, do you need to go to the ED? Better to go to urgent care. Faster, you'll get seen immediately, and you won't wait 4 to 6 hours, and it's lower cost.
Right.
And then number three, so that's the education. And then number three, we try to every quarter send that information to our members, especially those that are high utilizers that might have complex conditions. We engage with them through either education or we partner with organizations to provide them with information at home or tools at home that help them to stay healthy at the house.
So we get just a minute left. Worcester State University, the partnership.
Wonderful partner in Barry Maloney, the president of Worcester State, who you and I both know well, reached out about partnerships, and boy, we cemented and engaged in a long-term relationship to both promote the organizations, but more importantly, to encourage his employees and our members to stay healthy. So we have a long-term arrangement. that Wellpoint will support their health facilities, both to engage their employees but also their students.
Right.
Education and health go hand in hand. The healthier you stay, the more educated you are, the better productive society community we have.
Good stuff. Worcester State, hugely important to the region and the healthcare industry. Good stuff. Well, David Morales, General Manager of Wellpoint, great to have you with us, and thanks for your engagement and involvement in Central Mass.
Thank you, Tom.
We're going to come back for our third segment. Stay with us.
Since 1889, Bank Hometown has stepped up to bat for our neighbors. In the past 5 years, we've donated $1.3 million to local organizations that help enrich lives and bring people together. And we're not stopping there. We're always looking to tackle the challenges of today and fuel the leaders of tomorrow. No matter how life changes over the years, we'll continue to show up for our neighbors, for our communities, and for you. Bank Hometown. Unlock your potential.